learning outcomes for the module on inhaled medication. In this module, we will cover the following points: the correct approach to check the 6 rights of medication, communicating with the patient and giving detailed information, giving the medication and ensuring the safety of the patient, consolidating the process with care.
I'm going to go through the inhaled medication administration scenario. It's basically always the same medication, it's salbutamol, and we're using a spacer device, which is a more effective way to take the inhaler rather than the inhaled medication just hitting the back of the throat. So I'll go through that scenario with you now. Okay, so same thing, I would declare the area safe to approach, do the 7 steps of hand hygiene. 30 seconds to dry. So with this one, I am going to go through the whole introduction and checking the patient's name. So my name is Helen. I'm the nurse who's come today to give you the inhaled medication. Could I just ask what you'd like me to call you?
Peter.
Okay, Peter. Because it's okay to get your full name?
Peter McNamali.
All right. And what's your date of birth?
2280.
Okay, and what's your address?
2 Long Street, Northampton, NN2 7AL.
And do you have any allergies?
No.
Are you comfortable at the moment?
Yes, I am.
Okay, so I'm just going to screen the area for privacy and dignity, shutting any doors and windows and curtains. Just going to explain why I'm here today. So I'm here to give you this inhaled medication called salbutamol. It's an inhaled med which comes through an inhaler device called a spacer. This is to help you get the full benefit of the medication. Have you taken salbutamol before?
Yes, I think so.
So the benefits of it is it'll open up your airways and help you to breathe more easily. The side effects can be a rapid heart rate, you can feel a little bit shaky, a dry mouth, but these are temporary and quite common symptoms which do wear off. If you did have any really severe difficulty in breathing, it probably wouldn't be related to the medication. You would need to go to hospital, okay? So is it okay if I go and get the stuff together and I'll come back and...
That's fine.
Right, so I'm just going to go away and get the medication and all the stuff. So just gel my hands when I leave the patient area, and I will assume this tray has been washed with soap and water in the past 24 hours. I would give it a quick wipe. I'm not wearing gloves, but that's not essential. It's just to protect your hands. He's in his own environment, so it would be non-clinical waste. I'd also give the device a clean. So this is the spacer device. Because it's out, I don't know how long it's been out and when the last time it was washed, so I'm going to give it a clean. Again, that will just go into his domestic waste. And I would check the medication chart. So I've got Peter McNamali. It's the right address. The drug is salbutamol. So it's the right drug. I know I'm coming to give him salbutamol. 200 micrograms, which the dosage here says it's salbutamol, and the dosage says 100 micrograms, which means every puff is 100 micrograms. So it's 2 puffs. The time is the right time, so it's 1400 hours. It's 4 times a day, and it says special instructions to use a spacer device, and it is signed by a doctor. So it also says he has no allergies. So I'm happy that this prescription is legal and correct. And I'm just going to check this closely. It says it's salbutamol, and it says it's expires in 2023, and it's intact. I'm happy to use that. I would gel my hands again. So I'd go back to the patient now and explain the procedure. So I'm back again, Peter. So I'm just going to ask you to follow these instructions. So what I would like you to do is, again, sit up straight, breathe out, and I'm going to take this inhaler, shake it, put it into the handheld spacer device, ask you to grip it between your teeth and lips. I'm going to press down on the canister, and I'd like you to breathe in slowly over 2 to 3 seconds with your head tilted slightly back, and then I want you to hold it for 10 seconds and breathe out through pursed lips. You're having 2 measured doses, so we'll repeat that twice, but I will give you a rest for about 20 to 30 seconds in between, or longer if you needed it. If you feel you can't manage to hold your breath for 10 seconds, you can breathe in and out with the spacer. Which one do you think you'd prefer? To just hold your breath for 10 seconds, that's fine. Okay, so what I'm going to ask you to do is, first of all, I'm going to shake the inhaler, take the cap off, shake the inhaler, place it in the spacer device. I want you to tip your head back, shoulders back, tip your head back slightly, exhale, take the mouthpiece between your teeth and lips, and I'm going to give a measured dose. I want you to breathe in over 2 to 3 seconds. Okay, hold that for 10 seconds. 3, 4, 5, 6, 7, 8, 9, 10. Breathe out through pursed lips. Okay, so I'm going to give him a 20 to 30 second break. 30 seconds has elapsed. Are you okay? Do you feel ready to have another inhalation? Yeah, he said he's fine. So again, shake the inhaler. Tilt your head back slightly, shoulders back. Exhale. Take the device between your teeth and lips and breathe in when I press this for 2 to 3 seconds. Okay, so I want you to hold in and for 10 seconds, 2, 3, 4, 5, 6, 7, 8, 9, 10, and breathe out through pursed lips. Okay, so that is done now. I would take these pieces away and clean the spacer device and the tray. Make sure I sign for the medication straight away. And I would document in the notes that I have given Peter the 2 measured doses. He used the correct technique, and he's looking well at the moment. Advice given, and then I would put this stuff back where I found it, cleaning this spacer device after use and the tray. And Peter, do you want me to put your inhaler back where I found it? Yeah, he does. And I would write in the nursing notes anything, and I would leave then. So, putting that in his household waste. Gel my hands before I leave the house. And that would be the end of the inhaled medication scenario for the OSCE.